I'm David Ballard. I serve as president of the STEEEP Global Institute. I'm also the chief quality officer for the Baylor healthcare system. I grew up as the sixth child in a family of 8 of parents who were World War II veterans who had healthcare careers during World War II. My mother was a nurse in the European theater. My father was a surgeon. And so after the war, they settled in Lexington, Kentucky, where I was born. And I greatly admired my father, who was an ear, nose, and throat surgeon, admired his practice, his relationship with his patients. And my mother had 8 kids in 11 years, and so she spent a lot of time nursing us. But she also handled our dinner interruptions. We probably had about 20 phone calls on a typical dinner related to questions my father's patients might have, and she was incredibly adept at identifying which patients needed immediate attention and the attention of my father. So certainly in that environment, I thought about healthcare. I thought about healthcare quality, connections with patients. You know, at a little more abstract level, my father engaged all of his children in his practice, from as 9 and 10-year-olds filing cards in his office to later in our adolescent years. We did rounds with him at the hospital. 3 of my other siblings and I decided to pursue careers in medicine. And I certainly, as an adolescent, although I hadn't read the literature in depth, I certainly had questions about, so Dad, what's the indication for tonsillectomy in this patient, which over time certainly became a very interesting question in the healthcare quality arena. So those were kind of my initial connections.